Welcome to The Sensitive One. I'm Gina Susan Long, nutritionist for highly sensitive people. And today I'm going to be talking with Joy Anderson, who is an Australian dietitian and lactation consultant who has worked hard to educate the public and her peers about food sensitivities in babies and what we can do about it. I really respect that Joy was so passionate about bringing light to this area that she went back to university to study dietetics much later in life. You'll hear more about this and about Joy's work in the introduction to the interview. So that's all from me for now, and I'll see you on the other side. Today I'm speaking with Joy Anderson. Joy Anderson is a dietitian and a mother of two breastfed babies. And prior to becoming a dietitian, she worked for many years as a breastfeeding counsellor and a lactation consultant. I've invited her to speak with me today because she has been a pioneer, really, in understanding and addressing food sensitivities in babies who are being breastfed. Food sensitivity reactions are a problem that many breastfeeding mothers are facing today, and it has historically been under-recognized and addressed by both doctors and even dietitians. So after many years of working as a lactation consultant and seeing this problem in breastfeeding babies, Joy finally became motivated to train as a dietitian so that she could do more to help mothers with this issue. She's now retired from practice, but continues to mentor Australian dietitians to help bridge the gap in knowledge and support breastfeeding mums and their babies. She has also written a book about this topic called Food Sensitive Babies: Dietary Investigation for Breastfed Babies. So welcome, Joy, and thank you so much for speaking with me today. Just to start off with, this may seem like an obvious question, but I think the consensus, unfortunately, still isn't there. So I was wondering if you could set the record straight, Joy. Can babies have food sensitivity reactions to their mother's breast milk?
Yes, they can react to substances in the milk that have come from the mother's diet. So they're not actually reacting to the milk per se, they're reacting to things that have come through from the mother's digestive tract.
Would you be able to explain what breast milk is so that people can understand that concept?
Well, breast milk is made up of the main parts of it, obviously a lot of water, proteins, carbohydrates and fats. But the building blocks of everything in the milk obviously come from the mother's body, and her nutrients obviously come from her food. We often think that we have to think of things like proteins and carbohydrates. They get broken down in the mother's digestive tract, and we're taught at school that they get broken down to amino acids in case of proteins and individual sugars and things in carbohydrates. But the process is actually not 100% efficient, and there are other chemicals in foods as well. So the mother actually ends up absorbing chunks of proteins, various chemicals that may be imparting things like flavours in foods, or other chemicals that come from the original source of the food, from the plants.
Do you mean artificial additives?
They can, yes, they can be some of the things that get absorbed, but there's natural chemicals as well. So a lot of these things potentially can get into breast milk, and if the baby is sensitive to any of those, then they can actually cause reactions.
And breast milk is part of what it is really a filtrate of the blood, isn't it?
Yes and no. I mean, some of it is. A lot of I suppose the things that come through the milk that cause the trouble are sort of like that. There's a lot of components of milk that are actually made specifically for the milk in the cells in the breast. So it's a mixture of those two.
But the food additives and the food chemicals that are coming from the food, they come through the blood? Is that right?
Yes.
Okay. That's so interesting.
Yeah, it's quite complex.
Yeah.
I think there's still a lot we don't understand about breast milk and, what's in it. And, we're still finding things.
How did your journey with helping breastfeeding mums with food sensitive babies begin? Because you started off as a lactation consultant and then
Yeah,
you went on to study dietetics. So how did that all happen?
well, I suppose it's a combination of helping breastfeeding mothers and also my own experience with my own children and my own body, finding out that our family has food sensitivity. And so when I was helping breastfeeding mothers, I started to recognise that some of the problems were probably related to that. So it sort of, put the idea into my head from my own experience that this is what could be happening for other mothers and babies. And I tried to get these mothers extra help, sort of suggesting they see a dietitian, and discovered that there really wasn't anyone out there that I could find anyway that seemed to know anything about this specifically. So I thought, well, if there's nobody else doing that, this is a need. So I decided it would have to be me.
Good on you. And I'm curious to know, so mums were coming to you for lactation consulting and they were having issues obviously with the babies. What kind of issues were the babies having that caused you to think, okay, there's something happening here where they're possibly reacting to the milk?
Um, yeah, this is some years ago now. I mean, probably a lot of them now would be considered babies with reflux. In those days, it was colic. Basically, it was just a very unsettled baby. Sometimes they'd be refusing to breastfeed. Mother would go to breastfeed the baby would sort of latch on and then come off and cry and push away. And sometimes they weren't even getting enough to eat. So, they weren't gaining weight well. They were just very difficult babies. And, that was where I started to think, well, maybe there's something going on in this baby. They're not feeling good. And that, possibly could have been food sensitivity.
So are the symptoms mostly gastrointestinal?
Yeah, most of them probably are. Generally, it is gut symptoms, vomiting, reflux, really unusual stools, so lots and lots of mucus, sometimes blood in the stools, things like that, and just gut pain, so babies being very unhappy and very unsettled. There's also skin symptoms. You get a lot of eczema. I know, eczema is something that has a lot of different potential causes. Often people will say, oh, food's only a minor part of it. But my professional experience when I was working as a dietitian was, I think every baby I saw with eczema whose mother suspected food and wanted to do dietary investigation, it actually worked, that the eczema was being triggered by foods. So of all the ones who I have had professional experience with, modifying the mother's diet vastly improved the baby's eczema. Now, a lot of doctors will say, we don't really know what causes eczema, and we don't really. Some of them, it's to do with a genetic abnormality in the skin's barrier. So it's probably multifactorial. There's probably several things that contribute to this. But certainly in a significant number of cases, I've actually found that foods can flare it up. So avoiding the foods is one thing that can often help to keep it under control. I'm not saying it's a cure, because I say there's other factors involved in the development of eczema. And babies do tend to get a lot better as they get older. A lot of doctors will say, oh, they'll just grow out of it, just use some creams on it for now to keep it under control. And certainly I do agree with those sort of treatments, because if you don't control eczema and the skin barrier is not good, then you're risking getting more allergens into the skin, such as food allergens, perhaps, from people's hands or being kissed. And you can actually induce new food allergies that way. So having a good skin barrier is really important.
So what you were saying is that if you treat it, even if you do use cortisone, it's better to treat it so that it's not broken, and you don't
Yes,
have that risk of developing an allergy
yes.
from contact.
I think a lot of
Okay.
parents are worried about putting steroid creams on their babies, and maybe are very reluctant to do that. But actually, you're risking more by not using them than by using them.
Okay.
They are, if they're used according to how the doctor prescribes them, they're very safe, and you're really reducing the risk of further allergy development if you use them and keep the skin in good condition.
Yeah. So I guess the key message is that you need to clear up that eczema somehow to avoid developing other allergies.
Yes, if you
Yeah.
can. Yeah,
Yeah.
moisturisers at the very least. But follow doctors' advice over sort of creams and things, because it really is worth it.
So I'm interested to know, in your experience, do you find that doctors are aware of the fact that babies may have food sensitivities when they're being breastfed?
I don't think they get very much education in their courses on this specifically. They know about allergies because allergies can be life-threatening, and those are the antibody or IgE mediated allergies, and they're the ones that you can do allergy tests to pick up. But there are the non-IgE mediated allergies that don't come up in allergy tests, and doctors do know about those because you tend to get more gut symptoms, and the eczema and things, they tend to be, especially in babies, from those. But there's a whole raft of different sorts of food sensitivity that most doctors don't really know much about. I think it would be wonderful if they have patients with these sorts of queries, that they actually check them to make sure that there's actually nothing medically amiss. It's very important to have babies who are unsettled or have symptoms to be checked out medically in case it is something else. But then if they can't find anything wrong, then it would be good if they could refer them to a dietitian with experience in allergy to give them sort of more help.
Do they generally, are doctors quite good at referring to dietitians for those sorts of things?
Not in my experience, no. They don't tend to think about dietitians very much, I don't think, as far
Hmm.
as I've found. I don't know whether it's because as dietitians we don't promote ourselves well enough, but as a general rule, doctors tend to think of other doctors who are specialists. That's their referral chain, it seems.
So would your referrals be more likely to be from a gastroenterologist or an allergist, perhaps, so a specialist might refer to a dietitian?
In my experience, I didn't really try to even promote myself much to the doctors, because they don't tend to be very forthcoming. I don't know about other dietitians, they might have some relationships, but my clients tend to be self-referred or through their child health nurse or a lactation consultant. They're more the ones that were aware of what I did, partly because I would give talks, and there was a lot of those sorts of people in those professions in the audience.
Are there many dietitians out there who have an understanding of food sensitivities in breastfed babies and how to support that? Or do you think there's still a lack there?
Um, yeah, there is a lack, I think. It's not something that's covered very well in the university course, even for dietitians. I believe when I did dietetics, we didn't even really cover allergies, which I thought was a bit of a bit missing. Um, I believe now, because allergies now become so much more common, that there are a lot more dietitians who deal with allergies and food intolerances. Not that necessarily that many will deal with breastfed babies, though, because that's sort of very specific if you're talking about food intolerance sort of going through another person into a baby. So there's a handful around Australia that I know of who do remote consulting, who have a specific interest in this area as part of their practice.
And you have a list of them, don't you? That
Yeah.
you do offer to
Yes.
people. Yeah. I just, the reason I'm asking is because just talking about the fact that doctors don't generally refer to dietitians, or maybe not as frequently potentially as they could, for these kinds of problems. Where are people mothers who are having issues with the babies, where they do seem to be having these reactions that are being breastfed, where are they going to be looking for support?
Yeah, that's one of the problems. Quite a few lactation consultants can help to a certain extent, because I think too that's often where they go first, because really to determine whether a baby's reacting to food, you really need to rule out breastfeeding issues. So, for example, if a baby's getting a lot of milk, if a mother's got a big milk supply, then the baby can look very colicky, cry a lot, can be very unsettled, and look a bit like a baby reacting to food, where sometimes it's really just they're getting too much milk too fast, and they're getting what we call lactose overload. The milk's going through them very quickly, and the lactose is excess, and it's getting fermented in their large intestine. So the bacteria in there are creating a lot of gas and drawing in liquid. So they have all these hallmarks of colic. So it's important that mothers actually rule things out before they go to the extent of wanting to investigate their diet. As I mentioned earlier, they should see a lactation consultant, see their doctor, just get everything checked out to see what could be impacting on the babies, because babies can't tell you exactly what's happening. All they can do is cry. But it certainly, you need to rule these sorts of things out.
The allergies tend to be more recognized medically, don't they? Whereas the food intolerances or the food sensitivities aren't really maybe well handled by doctors. So it's not really their area.
Yeah. Yeah. I mean, allergies that are treated in an allergy clinic or a hospital, they are fairly well-defined immune problem. If they're IgE-mediated allergies, then they have the potential to cause anaphylaxis or other quite severe reactions. And so they're obviously taken very seriously. Allergy people would also consider the non-IgE mediated allergies. Depends who you read or who you listen to, how people actually define these terms. To me, a food sensitivity covers any reaction to a food. So it includes allergies, but it also includes intolerances. And the intolerances can be to food chemicals, such as artificial additives, such as natural food chemicals. The main groups of those are salicylates, amines, and glutamates. And those natural food chemicals are in normal, healthy foods. They're often responsible for giving the food flavour, and what makes the difference between what one food tastes like to another. We also know that some people react to things called FODMAPs, which are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which is a real mouthful, so that's why we call them FODMAPs. They're basically dietary fibre. So they occur in foods and they're good for us. The other term for them is prebiotics, and they feed the bacteria in the bowel. Now, we used to think they couldn't affect breastfed babies because to get into milk, it has to be absorbed. And these FODMAPs, the reason they cause people gastro symptoms is that they're not getting absorbed, they're getting fermented in the bowel. But we've now found that some babies do seem to react. Now, we don't know how, we don't know the mechanism, we just know that some mothers who had colicky babies and tried a diet with low FODMAPs, the babies got better. So, there's so many different things, different sorts of chemicals. There's so much we don't know. Unfortunately, there's no drug companies or anything out there who want to throw lots of money at research into this, because there's no sort of drug or product and the end result that they're going to make money out of. So it doesn't tend to get researched.
And it's quite difficult to do research on food sensitivities, isn't it, when we're talking about
Oh,
food intolerances?
yeah, it's very difficult. First of all, you have to have all your participants have to actually be food sensitive, so you have to be very selective. If you do it on the general public, you just don't get any results. And then the gold standard is randomized controlled trials, where you're supposed to blind participants to which treatment they're getting, whether they're getting a treatment or a placebo. And that's extremely hard to do when you're dealing with food, because people know what they're eating. So, yeah, the combination of all those things plus no money means that, we just don't get studies. And if there's no studies, then the doctors think, that to them, if there's no evidence, then it doesn't exist. That's the dilemma we have.
Yeah. And it's difficult to control for other confounding factors when
Oh,
you've got food as well, isn't it?
absolutely.
So
Yeah.
other things, other components of the food, aside from the ones that you're looking at, so such as the food chemicals, that might also be having an impact.
Well, when you're dealing with breastfed babies, there's so many other things happening as well. And that's one of the things with food sensitivity, is that if the person, and this even applies to babies, are being impacted by other stresses in their life, then they can become more sensitive. So if the baby's teething, or perhaps had an immunisation, or they're going on a holiday, or grandma's come to stay, or, it's Christmas, all of these things can be potentially upsetting in a baby's life, and can, sometimes make them more unsettled, sometimes can make them more sensitive if they're food sensitive. And it does tend to get very hard to work out, what's actually going on.
Yes. And then, of course, there's the gut-brain connection. As you say, that there can be stress, and
Yep.
stress can have a big impact on how the gut is functioning. So,
Yeah, that's right. Yes. And basically, most people who work in this area are just working flat out, helping as many people as they can. And, we don't really have time to worry too much about trying to get things into medical journals, because just don't have time, and not really have the opportunity.
yeah. I heard a criticism recently from somebody who I think was, I don't know if they were an allergist or a doctor, but they said that there isn't enough evidence to show that the low food chemical diet is actually effective.
Yeah, I think that the operative word there is evidence, which is what we've just been talking about.
Yeah,
There,
and
there isn't a lot of evidence because there's just not a lot of research.
yeah, and my thoughts on hearing that was that phrase, there's not evidence to support this diet, can be very confusing for the general public, because it sounds like they're saying it doesn't work.
Yes, yeah,
Yeah.
and I think that's what they believe. But there's no evidence that it doesn't work either. And we have, admittedly, anecdotal evidence is considered very poor quality in the scientific world, but it's basically all we've got, or most of what we've got. There are some papers that I've found, some out of Europe, that even just very recently I've seen at least one, but there have been several on specifically on histamine intolerance. Now, they're not talking about breastfed babies, they're talking about just intolerances in adults. But there's certainly some evidence out there if you really look hard. And we also know from Royal Prince Alfred Hospital Allergy Unit in Sydney, and they have written books, and way back when they first started doing their food chemical elimination diet, they did do research. Anne Swain did her PhD, I believe, in salicylates in foods, and she's the head dietitian there. And the director, Rob Lobley, he's written articles. They're all very old now. I think that I don't know if they've done anything fairly recently, but certainly he did an article about how food chemicals can cause urticaria, which is skin rashes. And since that time, they've been doing a lot of work with patients and clients as they've come through over decades now. And the diet works. We know it works. And a lot of dietitians have used their advice and their information. They have an elimination diet handbook, and they've written a cookbook called Friendly Food. And then Sue Dengate, she started the Food Intolerance Network. Her diet, her fail-safe diet, is basically the Raw Prince Alfred diet. And she's had lots of experience over many years now with people using the diet, especially for children with behavioural problems, but all sorts of symptoms. There's lots of people who are sensitive to food chemicals. So, we know from just practice evidence, I guess, that these diets do work in a lot of cases. It's not the answer to everybody's, but it's certainly something for a lot of people. A lot of us live our lives thinking, we've got these niggling symptoms that don't really affect us terribly. In some cases they do. Some people have migraines and IBS and these sorts of conditions that can be quite debilitating. And it's definitely worth any of these to do dietary investigation to see if food can be part of the problem and a trigger and something that they can control to reduce their symptoms. So, I think awareness amongst doctors of this sort of thing would be really beneficial for a lot of people.
It's really interesting because I think so many people are experiencing things like irritable bowel syndrome or eczema or urticaria and don't necessarily make that link between food intolerance or food sensitivity and the symptoms. And unfortunately, and this has been my personal experience, which is very limited, but it is my personal experience, that when I wouldn't say I was diagnosed, but when it was suggested to me by my doctor that I had irritable bowel syndrome, it was never suggested that I should see a dietitian or that I should look into food intolerances at any point. And I find that really strange.
Yeah.
Yeah.
I know. I think it's getting better in a lot of places because at least doctors have read about the low FODMAP diet and, they may think of sending someone to a dietitian because they can then test out whether it's FODMAPs, because that's, been found to be a significant factor in a fairly high percentage of people who have IBS. But food chemicals can exacerbate the condition. I don't think food investigation can really cure any of these totally. I think you always got that background tendency to whatever the symptoms are. What I think controlling the food triggers can do is make them much milder and much more controllable.
Manageable, yeah.
Yeah, I see these things on TV about some new treatment for migraine. There was one the other day, and I thought, that sounds interesting. And of course, it's another drug. Whereas we know for a lot of people, there are foods that trigger migraines. And whereas avoiding those foods might not necessarily make you completely migraine-free, they can potentially make them a lot less severe. So, I think we are missing, our medical system is missing a lot by not recognising that food can have such an impact on so many different symptoms and things that people suffer with.
And so when babies are struggling with breast milk, when they're having these symptoms, what do doctors usually recommend? So what is the usual course of treatment?
I think it varies. Some of them who do think about food allergy, at least, might suggest that the mother trials a dairy-free diet because it's fairly well known that of all the foods that potentially affect breastfed babies, cow's milk seems to be on top of the list. But then they might say, oh, well, if that doesn't work, then you can always wean the baby and give them one of these specialised formulas.
An elemental formula?
Yeah, or extensively hydrolyzed. So the extensively hydrolyzed ones, and then there's elemental. The government doesn't like doctors going straight to elemental formulas because they're so expensive and they're usually paid by the PBS. So they often will trial an extensively hydrolyzed one first, and that actually works fairly well for most babies who are allergic to dairy protein. And then there's a subset of those who don't get better, and then they go to elemental ones.
And what does elemental mean in this context, just for anyone who's listening and doesn't know what an elemental formula or a hydrolyzed formula is?
Okay. Well, hydrolyzed, it's the protein that they're worried about, because the idea is that the baby's reacting to cow's milk protein. So with an extensively hydrolyzed formula, they take normal formula or normal cow's milk and they treat it to break up those proteins into smaller chunks, and that makes it less allergenic. With elemental formula, those chunks are further broken up, and the only protein in the formula are amino acids, which are the building blocks of protein, so the individual units. So there can't be any allergens as such, because an allergen has to be a chunk of protein at least with a certain shape. And if you break it all up into, it's sort of like a string of beads if you have a protein, and it folds up into a shape. And so if you break all that up into those individual beads, then in theory the baby can't react to it at all, because there's no allergen to react to. The thing that they don't acknowledge is that some babies still react to elemental formulas, and we don't know exactly what they're reacting to, but we suspect it could be other components of the milk, because somewhere they have to put into that milk a fat source and a carbohydrate source and vitamins and minerals, and to make it a complete food. Now all of these things have to be derived from other foods somewhere along the line. So if a baby's reacting to a particular food, there could be traces coming through from those other sources. And the other thing that I don't know if this happens, it's more just a theory, but glutamate, which as I mentioned is one of the food groups from the food chemicals that some people are sensitive to, glutamate is actually an amino acid. Now if it's just in small amounts from your food, that's fine. But glutamate is often used as an additive, and MSG is glutamate. When you chop up these proteins in the elemental formulas, you're going to have glutamate floating around free. Now, if a baby's reacting to glutamates, is that enough for them to react to that? We don't really know, but it's just another possibility.
And I mean, it's pretty sad if you have to take a baby off breast milk as well and put it on an elemental formula.
Yes.
Yeah.
Yeah. I mean, some mothers will say, okay, if that's what I need to do because my baby's suffering, then they will do it. But they will often be very sad that they've had to do that. Other mothers will say, no, I want to keep breastfeeding. There must be a way to keep breastfeeding, and can be quite determined. Clients that I used to see were the second category. I guess that's why they came to see me. And some of them, they were absolute troopers. Some of them would do the most extreme elimination diets, probably in a lot of cases stricter than I had even recommended that they try. They are amazing to be able to do that, to try and sort out the problem that their babies had.
Yeah,
And
absolutely.
sometimes they would actually discover that any symptoms that they had and hadn't realised that were associated with food would change and disappear, and would discover all sorts of things about themselves. And if they were using the elimination diet for the rest of the family, so they didn't have to cook several different meals, sometimes they'd actually find things changing in other family members. So it often became a real eye-opening experience for the whole family.
Yes, I've read Sue Dengate's book Fed Up, and she spoke a lot about that happening with families on the fail-safe diet.
Yes,
So
yeah,
that was really interesting.
yes, yes. And Joan Breakey found the same thing. She's a Queensland dietitian who's also retired. She wrote a book called Are You Food Sensitive? And she has a website as well, Food Intolerance Pro, with a lot of information about food intolerance on that. And that was one of the things she started to realise early on, that it wasn't just the individual child that the family was investigating. They'd be doing the diet for the child, and other family members would find that other symptoms, such as things like IBS or skin rashes, or maybe they had foggy thinking, that was another one that used to come up, that they go, all of these things have stopped and got a lot better on the diet. And they all discovered that the whole family was food sensitive. So, I think anyone who's been, was it Sue Dengate, with Joan, Royal Prince Alfred, other dietitians, we've all found the same thing, that clients come back to us and say, this has just been an amazing experience for us all.
That's that's fantastic when that does happen. So I'm curious to know if you could actually take us through the process of what happens, or what would happen when someone came to see you and they were having issues with the baby was reacting to the milk. How would you actually go through this process of doing the elimination diet, or deciding which diet to do?
The first thing would be to get a really thorough history about everything that's happened since when the baby was born, perhaps even things that happened during pregnancy, and asking about a family history. So the baby's parents, grandparents, if there's any siblings, aunts, uncles, and asking whether any of them had had any of a whole list of symptoms. So a lot of things that people don't necessarily connect with diet. So you can't just say to them, are you food sensitive? Because most of them will say no. But then if you say, have you ever had a rash, or have you ever had migraines or IBS, or all sorts of different sorts of symptoms that you can have. From that, you can build up a picture. Some of my clients didn't know until I sent them the questionnaire about some of their relatives, because they'd get the questionnaire before the consultation, and they would ring up family members and say, can you tell me about any of these sort of symptoms? And sometimes you'd get a picture from that of lots and lots of different symptoms, or sometimes someone might come in and there'd be all allergic type symptoms rather than food chemical type reactions. Sometimes it'd be virtually nothing. And you'd think, is it really food going on here? So that would start giving me an idea of the sort of direction that might be your best bet that we could try first. I would explain about the different sorts of diets to the mother, what it would involve, find out what she's eating at the moment. Does she cook from scratch? Does she eat a lot of pre-prepared foods? What are her cooking skills like? How much time has she got to devote to this? Just the practicalities of, what sort of strictness of diet she'd be able to manage, because it's pointless giving her a really strict diet when she's just not going to be able to carry it out. So you're just wasting everybody's time. And I'd give her a lot of information about the sort of foods to choose. I had copies of Sue Dengate's cookbook, the Fail-Safe Diet Cookbook. So give them a lot of resources to make it as easy as I could for them. And then they would, and make sure they did a food diary. It's really easy to forget how bad things are when things get better. So when you do any sort of dietary investigation, it's really important to write down everything that you're eating and anything else relevant that there's a particular stress or something, because that, you know, that can impact how sensitive you are and how sensitive your baby is. And then it was usually around 3 or 4 weeks they'd do this for, and most of the time they'd send me an email, or sometimes they'd send it to me about 2.5 weeks going, I don't know if I can do this much longer. And you'd say, just hang on, a few more days. And then I'd get one at about 3 weeks saying, oh, got a new baby. Suddenly, stop crying. Everything's wonderful. And you think, right, okay, it's time for challenges. So that's where I'd bring them back and we'd talk about how to do challenges, which means introducing one food or one food type, like chemical or foods that contain one type of chemical, back in one at a time and seeing what happens. So there's a process to go through. That can be quite time consuming, because if a baby actually reacts, then you have to stop and then you have to wait until the symptoms disappear again, and then you need 3 days without any symptoms, and then you can start another challenge. So the mothers would go away and do all these challenges, and I'd keep in contact by email to see how they were going, and they're keeping their diaries going. So it's very intensive and they have to be pretty dedicated. Once they've figured out, they might come back and say, oh, there's a different reaction to dairy and salicylates, but I was fine with wheat and eggs, and, you know, and they'd have their list of reacted, not reacted. And then there's a third phase where you then need to take the ones that caused a reaction and look what you can get away with. Is it okay if you eat it once a week, or perhaps a food that's got a little bit more of that chemical in than the ones that were on your diet? So you refine it, and so the whole process takes quite a long time. And then when you're dealing with babies, they're getting older, they start going solids, so you get all these complications, but they do tend to get less sensitive as they get older.
It sounds like the elimination diet was quite thorough. So it was a number of different things. It wasn't just food chemicals like salicylates and amines and
No.
glutamates. It's also wheat, eggs,
Yes,
dairy.
often it was. If we suspected allergy, then we'd definitely address the allergens. Now, some people will say, oh, you should only eliminate one food at a time and see if, you know, to find out what causes a reaction. The problem with that is that it's a fairly rare situation, in my experience, to be just one food. If there's only one food, it probably is dairy, but it's very common for them to react to more than just one food.
Because it isn't the risk that if you take out one food at a time, if there are other foods that are still in the diet that that person is reacting to, or even that the baby is reacting to, that you risk kind of masking the response because you're still having symptoms.
Yes, you won't get rid of the symptoms if there's something else causing a reaction. So a lot of my clients would be doing not necessarily the fail-safe diet, perhaps a little bit more moderate version of that, plus avoiding the major allergens: dairy, soy, wheat, eggs, nuts. Fish usually isn't something we worry too much about. It's pretty unusual for babies to react to fish, but definitely they can react to any of those others. So, yeah, often that was a combination type diet. And because it's so strict and so hard to do, it's got to be time limited. So that's why we only do it for a few weeks.
Would you also take FODMAPs out of there as well for an elimination diet, or would it just depend on the symptoms?
If it looked like it could be FODMAPs as well, you could either do them one at a time. I have had people want to eliminate FODMAPs and food chemicals at the same time. And if you do that, you really can't do either of them super strict, because there's just not enough foods left. So you can do it, you just have to do a more moderate version of both together. And this is where I think it's really important to have a dietitian help, because they will know which foods are most likely to be okay. and, get the best results from the investigation.
Yeah, based on the symptoms.
Yeah. So the level of strictness, the number of combinations you put together, it becomes very individualised for each mother. And this is why it really worries me that lots of mothers, they go on these Facebook groups and they, someone says, oh, I'd cut out all of these things and that worked, maybe that'll work for you. And they start trying to do it by themselves. And they either don't really get anywhere, or they go so strict that they end up with malnutrition because they're not eating enough. Even on the fail-safe diet, if you eat a range of the foods that you're allowed to eat, it's very bland and boring. But at the Royal Prince Alfred, they've actually determined that it is nutritionally adequate. But you do have to be careful, what you include and what you cut out.
Mm. It has a psychological impact and a mental impact as well, doesn't it? Having to cut out all these foods.
Yeah, well, for a start, it's very socially isolating.
Yeah.
I suppose less of a problem with COVID-19 around, I suppose. But, you can't just, go to restaurants or go to your friends, or, when you have a baby, people bring you food to help you out with meals and things. And it just becomes so difficult to do anything like that. If you go anywhere out, you virtually have to take your own food everywhere you go, because a restaurant chef, their aim is to do precisely opposite to what a low chemical diet would be. They want their food to be tasty and yummy and
Yeah.
really,
all the foods that are high in salicylates and amines and glutamates are the ones that add flavor. So like
yes,
the
yeah,
spices and the
yes,
fermented ingredients like soy sauce and
that's right.
the glutamates, which are found in flavor enhancers.
If it tastes good and it tastes strongly, it's going to be high in chemicals, because that's what's giving it those tastes. So low chemical foods are really very bland.
Obviously, eliminating long term is stressful. And
Mm.
so what actually happens in the long term with that? Where do you go from there?
That's what I was saying about the different stages. So you do the challenges to find out which foods don't cause problems, in which case you can bring those back. So already you're liberalising the diet. And then you do the stage 3 of refining how much you can actually get away with of the foods that do cause problems, so that you might be able to start bringing back small amounts of those, or foods that only have a moderate amount in them. And so you can keep expanding the diet. You also keep checking, like challenging, I suppose, every now and again, just to see whether the baby has become less sensitive. Some mothers have found that the baby reacts really quite badly when they're young. And then when they get to around about 12 months, that they don't react nearly as badly, and that then they can start eating at least small amounts of it even directly. And that the time that this happens is very variable. I've had one client, I think, whose baby had quite dramatic reactions, but by the time the baby was 6 months old and on solids, they didn't react to anything at all and grew out of it really fast. Whereas others, as the children grow, they could be still sensitive, right through primary school, right into adulthood, there's and everything in between. So it's a matter of just testing and trying as you go along, as the child grows, to discover, do they still react to something? If they do, is the reaction bad enough? People will say, well, I want to eat that food. I know that it's going to perhaps, give them diarrhea, or I don't know, something. But maybe they decide that every now and again that they'll just put up with that. Everybody's different. So it just depends how much it affects their quality of life. And if it doesn't affect it very badly, then they might decide to just live with that.
So that, I guess that answers my next question, which was, do food sensitive babies recover from intolerances?
Anyone who's food sensitive probably is always food sensitive. Often the symptoms change. So they might have certain symptoms as a baby, and then as they get older, they might get different symptoms. And as they become adults, it might change again. But also the susceptibility changes too. So particularly in women, hormone levels seem to make a difference in a lot of cases. As women, we go through so many different hormonal stages, and some of them we become more sensitive and others less sensitive. I think we always have a tendency to be food sensitive, but certainly babies who seem to be quite severely food sensitive when they're breastfed often do become more tolerant as they get older. But yeah, it just fluctuates a lot throughout life. I've often mentioned to some of my clients saying, if you work this out now when they're young, even if it seems they've grown out of it, that if something crops up, when they're going through puberty or something, then you already know the first place to look for possible causes of getting worse. And even I know Sue Dengate, she talks a lot about children with behavioural problems. I've had a few clients too whose children had a child diagnosed with ADHD, and they've come to me because they said, I've heard that diet can actually help because we don't really want to put him on medication. And indeed, it does. And I think Sue Dengate will tell you the same thing, that it can make the difference. It can't cure kids of the tendency to hyperactivity, but it can make the difference between a child needing medication and not needing medication. And, if you're aware of food chemicals that can impact some of these sensitive kids.
Yeah, that's such a big one, I think. It's another one where I think, it's such a shame that when parents go to see the doctor and they get sent to have these tests done and assessments to find out if the child does have a diagnosis such as ADHD, or if the child simply is demonstrating symptoms of, hyperactivity, that they often don't get told, or I don't think they ever really get told, that it could be related to food. And to me, the important thing is that people are given the option or the knowledge to be able to go and explore it themselves and make decisions about what they want to do.
Yep.
Whether
Yeah,
they
I
want
agree.
to go on medication or whether they want to try something else first, or maybe they want to do both.
Yeah.
Yeah. So I really feel like parents are deprived of that knowledge because it isn't just given to them. And you have to find books like Sue Dengate's book to actually discover that.
Yeah. Yeah. There are a few enlightened medical people around, I have to say, but as a general rule, yeah, it's not something in their training. And, I suppose it's very hard for doctors. There's so much they have to know. And, like a paediatrician needs to know everything, something about just about every possible disease or disorder in a child. These sorts of things just don't really get covered, I don't think, in those sort of courses.
Something else I was curious to know, I'm not sure if you have any answers about this, but there's been different information given about when is the best time to introduce potential food allergens to children. What is the consensus now?
Yes, I think it's fairly certain now. We've actually got some good evidence from randomised controlled trials, finally. It's now thought about the immune system is more likely to tolerate foreign things if it meets them fairly early and if it meets them in the gut.
As
So,
opposed to the skin.
yes, I think one of the problems, we used to think, we can withhold all the allergens because we'll wait for the immune system to mature and therefore reduce the risk of allergy. Well, they did a big study in the UK on peanuts and found that if the child was introduced to peanuts somewhere between the time they started solids, which was sort of somewhere between 4 and 6 months, and when they got, I think the oldest one was 11 months that they enrolled in the study. So we're saying sometime after they start solids, but before they get to a year old, introduce the major allergens, especially peanuts, because peanuts is the one they actually did the study on, and keep giving them small amounts. So not just one off going, they're fine, and then not letting them eat it again. there's a much reduced, significantly reduced incidence of allergy development. They tested them again, I think, when they were about 6 years old. I'd have to go back and look at exactly the age, but it was somewhere around that age. The ones who had had the peanuts withheld from their diets for what they used to recommend at about 3 years, they had a higher incidence of allergy. There was a really interesting study they had before this one. They compared children in Israel and in UK and wondered why UK they had a lot of peanut allergy, but in Israel they didn't. And they found that babies were actually weaned onto a food that contained peanuts in Israel, but the children in the UK weren't given peanuts until they're 3 years old. And people were started going, wonder if there's something in this. And that's what was the basis of that big study. And so they just confirmed what they are starting to believe, that if you introduce it in the gut fairly early, then you're reducing the chances that the child will develop an allergy. And now there's a lot more research going on. There's a tremendous amount, I believe, looking at traces of food sort of getting into the babies even while they're in the womb and also during breastfeeding, and how this is affecting the immune system. The trouble is there's too many variations and other things that are impacting to really have a clear picture. But it's starting to look like we might in the future be able to give mothers supplements or suggest they eat certain foods that will help to get the baby's immune system to tolerate antigens and less allergy. So it's really quite exciting. It's fairly complicated.
When you say supplements, what do you mean? What kind of supplements?
Well, we don't know. It might be
Okay.
a particular probiotic, or it might be a particular type of food that, because they're looking at the range of human milk oligosaccharides that are in human milk. So these are sort of like your prebiotics or like your dietary fibre. They're actually in milk, and the formula companies have started to try and put some of these into formula, but so far I think there's only one type, or every mother has hundreds of different types, and they're looking at how the range of these and the variability of these, and how that also affects the range of bacteria that is in the milk, that the microbiome of the milk, which obviously derives from the microbiome of the mother, and how this relates to babies who are allergic and babies who are not. They've actually found that the milk of mothers who have allergic babies have a much narrower range of these human milk oligosaccharides, and also I think the bacteria, I'm not sure. And so I guess what they got to try and do is look at, okay, how can we make the range of human milk oligosaccharides in a mother who's got an allergic family history look more like a mother that doesn't have an allergic history, so that she's not passing on that tendency to the baby to get allergies. It's very early days, but I think it's fascinating trying to work this out, how we can actually use mother's diet and breastfeeding to reduce allergies. Because at the moment they say, if you breastfeed, it doesn't affect whether your baby has allergies or not. And that's because there's just too many variabilities going on. I was listening to a speaker just a few days ago, and they're actually saying that if it was with egg, I think, if there's egg allergen in the breast milk, then the baby's less likely to get egg allergy. But if there's also dust mite allergen in the milk, it actually cancels it out. So it's not just a factor, it's a thing about just sort of one or two or specific ones that you're trying to avoid an allergy to. You've got to look at everything else that's there. Yeah, it gets very complicated, but I think it's really interesting, and we'll get there. Just don't know when.
And so they're looking at different ways that they can actually help to prevent allergies developing in children, so specifically food allergies. And that's so important because there has been such a big increase over the last couple of decades, hasn't there?
Yeah, well, the thing is with a baby has an allergic family history, it almost inevitably starts off their allergy journey with food allergy. They talk about the allergic march. So the baby starts off with an allergy to a food, then they seem to grow out of that, but then they might develop asthma or hay fever. They may develop eczema at sort of almost any time, or they might develop new food allergies can sort of suddenly appear later in life. So it's like if you're an allergic type of person, then these things come and go potentially, but you always seem to have some sort of allergic condition. And I think this is what we want to try and find out, what the characteristics are in these different people and whether we can change that at birth or before birth so that they don't get on this progress of allergic conditions.
So, what advice do you have for any mums listening who think that their babies may be reacting to breast milk? What can they do?
I think they need to check their expectations for initially, perhaps see their GP, just, if there's something medical that needs addressing. Does your baby have an ear infection, or is there something else that is totally unrelated to food? See a lactation consultant, or at least ring the ABA helpline to rule out things like lactose overload or even low supply. If the baby's not getting enough, that's often the first thing people think of. But in fact, we have a lot of people ringing the helpline who think they don't have enough milk because their baby's always crying. And when you ask them about how much is coming out the lower end of that baby and whether they're putting on weight, you have to explain that actually they've got too much. This baby's taking too much and has lactose overload. So they're all really important things to rule out. And then if a lactation consultant can check the baby for things like tongue tie, if they're swallowing a lot of air, sometimes that makes them have symptoms like reflux. And they can check, how they're attaching, whether they're breastfeeding well, whether there's anything there that could be having an impact. And if you're ruling out all of those things, then seek some help from a dietitian who has interest in food sensitivity and in babies, and hopefully get some help there.
And where would they go to find a dietitian who would have that knowledge?
Well, say Sue Dengate's got her list of dietitians who work with food allergy and food intolerances. Not all of them would necessarily deal with babies, but some certainly would. If you go on the Dietitians Australia website, there's Find an Accredited Practicing Dietitian facility, and you can look there because each person that's put their details in there has a list of the things that they are interested in. Now, some will list just about everything. To me, that's something master of none. Can't remember the saying now.
Jack of all trades.
Jack of all trades, master of none. That's it. Thank you. I would tend to sort of look for someone who has a fairly limited number of interests, but includes, I think it's called food allergy and intolerance, and infant feeding or breastfeeding, something to indicate that they understand food intolerances, but they also understand babies and deal with babies. And often people have asked me for names, and I've given out a few names, but they're specifically ones who do remote consulting as well. So there's probably other people around I don't really know about who would see people face to face and who may be good. I just know of a small group of dietitians who I guess I would trust with this sort of thing, and who also do Skype or phone or probably Zoom these days.
Yeah.
I don't know. I used to do Skype because Zoom wasn't around in those days.
And then, of course, there is also your book, isn't there?
Yes, yeah. Well, I hope that dietitians have my book. But I think if they work in food intolerance, they definitely will have the Royal Prince Alfred Hospital Allergy Unit materials. They may have Joan Breakey's. They may have Sue Dengate's. I'm not sure. Sue Dengate's not a dietitian, so she's probably further down the list.
Yeah.
But her cookbook is excellent for the low chemical diet. It's full of really easy, family-friendly sort of recipes. I mean, there's very much the same ingredients over and over again, but then it has to be because
That's the
that's
diet.
that's the diet. But hers is the strictest version of the Royal Prince Alfred diet. And with breastfeeding mothers, I've tended in the vast majority to suggest that they don't go the strictest version, that they go a more moderate version. And that's where having the Royal Prince Alfred Hospital Allergy Units materials there. You can buy those, I think, online.
I think they're technically only accessible to dietitians, but there are ways I think that you can order them from dietitians.
I guess that's because they, like myself, I've said in my book, it's really important not just to try and do this on your own using a book, that you do need to see a dietitian because everyone's different. Your situation is unique, and a dietitian will be able to give you individualised help. The book will be really useful in giving you a lot of information about how you go about this. But at the end of the day, it is an individual thing, especially not so much even at the beginning, but as you go through the process and, like refining the diet in the third stage, it's very individual. And I think it's important so that you do it efficiently and you get the best results, but also that you're not compromising yours or your baby's nutrition.
And I think that individual component is really important because, as you say, people do look for advice from other people, find out what other people are doing, and it's not necessarily what's right for you.
That's right. Yeah. Chances are it's not going to be. Now, if you know a dietitian, you go and see a dietitian because there happen to be one local to you. If she uses our books, when I say our, mine, Royal Prince Alfred's, Joan Breakey's, even if she doesn't do a lot of work with food intolerance, but if she's willing to read those books and use the information and work with you, then that should be fine.
If somebody wants to buy your book, where would they find it?
I sell it through my website. The website's dietetics and lactation.com.au. But if you Google my name and lactation or something like that, I'm sure it will come up.
Thank you so much for speaking with me and for giving me all of this time to answer some of these questions. I really appreciate it, and I hope that the people listening will as well.
Yeah, no, well, thanks for asking me. It's I'm always in favour of trying to get the message out as many ways I can, and if it can help some people out there listening and being able to perhaps take some action to help themselves and their babies, then that's great.
I hope you enjoyed this interview with Joy Anderson. In the next episode, we will be speaking with nutritionist and food intolerance expert Jennifer May, who aims to treat the root causes of food reactions and uses nutritional medicine to support recovery. So until then, I look forward to joining you next time.